Canadian Health Services Research Foundation. We exist to provide support to organizations and individuals who are working hard to improve the health services which they're delivering to Canadians.
There are a lot of challenges facing healthcare in Canada. We're working with health system leaders across the country at whatever level, whether at the hospital level, the provincial or territorial level, to really try to understand what those challenges are, what information we need to address them, and then bringing practical tools, practical information to those decision makers, to those people running the system, so they can improve healthcare for Canadians.
We produce a regular series of knowledge syntheses on the topic of how do you finance healthcare, what are the opportunities to pay for services and treatments that are not currently covered by the system. But we also examine what are the factors that are driving costs in the system to increase. And so we have commissioned research on behalf of experts across the country who synthesize the best evidence and put out policy recommendations as to approaches we could take or policymakers could take to improve efficiency in the healthcare system and make it more sustainable.
The Canadian Health Services Research Foundation runs a number of in-person, online, and interactive educational programs. One of those happens to be our Researcher on Call program, which brings together a researcher or a decision maker, people who are running the healthcare system, and brings together some new evidence, a new innovation going on in the country that we want others to hear about. Hello and welcome to Researcher on Call. What they get out of it is what they get out of a lot of CHSRF programming, and that is real practical information, practical tools and practical supports, and practical knowledge that they can use in their work when they go back into their setting and try to grapple with these kinds of problems.
The extra program, the Executive Training for Research Application program, provides fellowships to leaders in the health system. And these fellowships provide an opportunity for those people to become much more adept at using research evidence in solving the management problems that they face on a daily basis.
As part of the extra program, the project that I took on was really to focus on creating the foundation or laying the foundation for an evidence-informed decision-making culture at St. Elizabeth. It improved patient care, it increased the use of evidence in clinical practice, and helped us achieve better client outcomes and better overall organizational performance in terms of clinical care.
I think it's really important for all of us working in the healthcare system to know that we have to look outside our organizations for solutions and for catalysts and for initiatives that are aligned with where the organization is going or where the healthcare system is going.
We need to invest in the management skills in our system. If you look at the scope and scale of change that's going through our healthcare system right now, in just about every jurisdiction, it depends on the managerial leadership capacity of the people in the system.
Certainly not enough just to have ideas. You have to have ideas that somebody wants to hear about, and you have to have a way of working that people appreciate so they see you as a good partner. I think a very good example is what we're doing with the Northwest Territories. If the Northwest Territories is able to provide services more effectively, then people are going to be able to manage those chronic diseases better, and their lives will definitely be better. It's not us coming in saying, by the way, we have a really interesting recipe for dealing with chronic diseases. No, our approach is to learn together and broker in the expertise that is required.
There are different innovations, different ways of delivering care, different models of care happening across the country. What's important, and one of the roles for the Canadian Health Services Research Foundation, is to identify those innovations, identify those things that are happening and happening well across the country, and then bring people together to learn about them.
The work that was showcased at the conference, which we called Picking Up the Pace, almost 50 innovations in the delivery of primary health care. All of those innovations represented ways of delivering better services for Canadians.
When you look across the various sessions, how much innovation is happening across the country, and we take for granted that we share this information on a regular basis, but it takes forums like this one to really do that well.
If you want to make a change in the way you do things, you have to be able to bring people together. They have to all be convinced that a better way of doing things is possible, and that there is some evidence about what that better way is.